go for this, go for that, working full time and on the marathon since 1989, and had the fortunate opportunity to grow with the event and see it from its early beginnings to where it is now today. So I've been a partner of Chicago Event Management with many of you who know Kerry Pinkowski, the executive race director. So both of us had started working together back in '89 and business partners on the Chicago Event Management to run and operate the Chicago Marathon. So that's my quick two-second overview in terms of who I am and how long I've been around. So if you can imagine, I've been here for quite a long time and again, been having a great opportunity to work on the Chicago's marathon. So thanks, Chris.
Thanks, Mike. Thanks for that. And then introducing Hugh Singh, who's the Managing Director of Event Health Management, but also the Medical Director of the Singapore Marathon. Hi, Hugh. Why don't you just share a few things on yourself, please?
Thanks, Chris. Yes, I'm very fortunate to be the face of the Event Health Management team. And as you've alluded to, one of, I suppose, the more high-profile events that our team's involved in is the Standard Chartered Singapore Marathon, which I'm fortunate to hold the title of Medical Director and work with a fantastic race operations team and medical team to make my life a lot easier and make me look good for the work that I do. I suppose a bit of background, I've been floating around the event industry over the past 15 years. And like so many, I think that time probably passes very quickly, where you very quickly lose track of some of the projects you've been involved in and pick up a lot of experience along the way. So it's strange sitting next to someone like Mike, who's been around the industry for longer than I have and has so much to offer, and to be able to pass on some experiences as well. So hoping to be able to answer 2 or 3 questions today to make life easier for a few people.
Thanks for that, Hugh. That's great. And you know, as I said, I think, you know, reiterating, we recognise that the industry is going to be guided by government and the likes of, you know, World Health Organization and so on. There are already some great initiatives happening. There was one that was announced last week where World Athletics, IIRM, UCI, ITU have started to collaborate with some of their medical team in terms of some guidelines. There's many different think tanks and things happening. This is no intention whatsoever to try and say we're ignoring those, we're better than those or anything like that. It's just to try and bring as many people together as possible. This is a great time for collaboration. And, you know, one of the fantastic things that we already see coming out of it is people that would seldom even talk to each other collaborating on a regular basis. So, you know, we recognize we'll be driven by the powers that be. But if we can kind of shorten the timeline, be in a position where we're kind of ahead of the curve to a degree, using a term that's obviously bandied around a lot at the moment, but to try and get some guidelines in place and have something that organizers around the globe in our industry might be able to take to government agencies and have much more of a collaborative approach rather than wait for the rules to be imposed. So why don't we throw on to that? And Hugh, obviously with your medical background, when we were talking about you know, doing some of the planning on this, when we had our planning call, you were talking about some of the initiatives, discussions you're already having with, example, Singapore government, which is being held out as a leader in this. Some of the things that you see that are already happening in the space from a regulatory and ministries and WHO that might be useful for people to be aware of.
Yeah, there's a lot of movement at the moment, Chris, and I suppose the starting point is that every country, every state in every country is at a different point in time. We all become familiar with the term curve over the past 1 to 2 months, depending on where you are in the world. So depending on where you are on that curve and how big that curve is, probably is the first factor in considering how far we've gone down the path of looking at movement towards what does this look like when we get to that endpoint. There's obviously a lot of interest in the endpoint to see what might it look like moving forward, when do we get there, and some of the early discussions are starting to occur. The first questions are being asked, what do we need in place to work out where that endpoint might be? What is it that we might be looking at? What are the considerations that we need? In terms of where we're at around the world, there is a huge variation in different jurisdictions. I suppose you mentioned Singapore again a second ago. I suppose Singapore, for us and our involvement in the Standard Chartered Singapore Marathon, is an early December race. So as an example goes for the work that our team's working on, well, there's 365 days in the year. The size of that race and the nature of it being in December means it's something on our radar. We've got a long lead time before it comes up, and the benefit of looking at how so much of the rest of the world fares up until we get to that point in any decision-making time. And in the interim, there are hundreds of events all around the region that we're looking at throughout Australia and Asia. There is a lot of advice at the moment from all levels, and your question around agencies and organisations from WHO through to government, we could talk for months. And at the moment, it's such a complex layer where everybody has to consider what everyone else is saying and doing. Nobody has any complete answers at the moment. There is no firm guidance around mass participation or large numbers of people in one location. We know that it's not favourable anywhere in the world, and we do know that it will be one of the measures that all governments around the world will be very reluctant to reintroduce too soon. That being said, there's a lot of very good information from agencies who and governments around the world that have had some time to work on their guidance and their health guidelines. What there is an absence of at the moment is guidance into the mass participation industry, events in general, and mass gatherings. And the simple reason for that is that when you look at the magnitude of the situation the world's currently in, it is so big, so vast, and so undefined by way of duration and impact. At this point, no government knows where its economy is going to land. No government knows when this is going to end. There's a lot of commentary around media at the moment that talks around vaccines and how government decisions will be linked to vaccines. And the reality is the world doesn't have an answer on if and when a vaccine would be made available. What we do know is that process isn't quick. So there hasn't been too much forced, I suppose, guidance at any level from health organisation or government yet. What we are starting to hear, though, is a lot of questions. There was an initial wave of events that were immediately impacted during the months of March and April. We saw that from Boston Marathon and the London Marathon, both having to postpone their races to the second half of the year until the situation becomes clearer and better measures are available. But for races that were beyond that immediate impact, questions have been asked about, can they go ahead? If they go ahead, how do they do it? When can they reschedule to with confidence? And because we're seeing some of those questions, a lot of agencies are starting to ask, what is it that we might need to have in place? So I suppose to answer where you're at, there's more questions being asked at the moment, Chris, than guidance being provided. But Mike's probably got a lot of contribution to this question as well.
Yeah, Michael, thanks for that, Hugh. What are you seeing over in the US at the moment, and you know, yourself from a Chicago perspective, please?
No, and Hugh, that was a lot of great insight that you provided, and even here in the United States, and it's different depending on which region you're from, and the different states, and there's different stay-at-home orders, some that are relaxing now, and ours that in the Chicagoland market or the state of Illinois looks like it will be extended beyond the April date. So, we're trying to adjust and understand how that will impact what we're doing, even from just a company standpoint, and, when we might be able to get back to the office, when we might be able to get to the warehouse, let alone, even consider hosting a mass participation event. But some of the things that we have been doing, and I talked to Hugh and Chris just the other day about that, but try to take a proactive approach in terms of working with our government agencies and our permitting departments to see what we can do to help those municipalities come up with certain directives that we're taking, certain measures that we're taking, so we can avoid like a generalization when it comes to specific requirements that they'll apply to us to try to meet. right now they're dealing with the current situation, just like many other countries, other cities, other states, and that's taking all the focus. So they really haven't had, as Hugh had mentioned, really come up with any um, guidelines or even more in terms of any requirements that any special events, that being festivals, concerts, mass participation gatherings, and special events like ours. So we want to be able to get in front of that, work with different races and organizations. And one that we're working with is a group and organization called the Chicago Area Runners Association, and CARE is one of our nation's largest running clubs and advocacy group. So working with them, and they can work with other races to come up with some of these standards, and working with our city agencies to be able to come up with some of those standards. So we can really show them that we are prepared. Here are certain measures, and those are things that Chris had just mentioned that are being put together, and the collaboration between WHO and World Athletics. So that will come into play and be extremely helpful for a lot of us in these different areas, taking those bits and pieces to be able to include that in terms of here's some of the best practices that we're working on, so we have greater control in the process versus them and coming up with standards that might not be realistic or tenable for us or able for us to be able to meet. So it's a way for us to be able to be proactive and have a proactive approach to this. So those are things that we are collaborating on, and I think, Chris, you might have heard and seen our race management program summit, virtual summit that we had earlier today, or earlier today, here last night. And those are things that we hosted, and getting our industry together as well in a smaller group. And we had that discussion and talking about some of those items, and how we're being able to pull that together, the proactive approach, a lot of things that we can do as an industry to work with our communities, to work with our running industry or participants per se, and what can we be doing, and provide them that guidance, and try to be a good steward and make sure that our runners are running not properly but respectfully in terms of the communities in which we're impacting and running, and responsibly. So
Thanks,
hopefully
Mike.
that answered the question there. So
Yeah, it's great. And I think, it comes back to the point about collaboration. And, I had a couple of comments from Kelvin Tan in the chat. Hello, Kelvin. And, it's about this, opportunity for us to get a seat at the table early. And you've obviously done that at Chicago. And there's people from all over the world on the call here. Is what are you maybe doing in your groups? It's not just about the mass industry, but there's opportunities within the mass industry. But, festivals and events associations and so on, can you get together and see if you can get a collaborative seat at the table with the government and the various agencies that are involved? Moving on to the medical thing, and one of the discussions that we had, which I think is going to strongly be one of the potential limiting factors as we come out of this. And Hugh, the term you used on our prep call was battle fatigue. The fact that these medical staff are working around the clock right now. The point that you made which was very valid as well, is that many of them are businesses, even if they're funded by government. So their core business of doing operations and all those kind of things, elective surgery, has been pushed out the way. Once this finishes, we're going to need resources to have medical teams and so on. And what are some of the potential limitations that you see on that? Maybe starting with you again, Hugh, with experience in that space. It's something that my sense is that some organizers haven't really taken the time to consider that, even when governments say, yes, we can do this, how are we going to be able to staff these events? And we'll talk about other elements of staffing of volunteers and whatever, but you have an endurance event without a medical team, you don't have an endurance event. So what are some of the challenges around that going to be?
Yeah, you're right, Chris. There's a number of challenges around the availability of medical personnel. There are only so many in the world, as we've discovered. Social distancing in every measure we see at the moment is very much focused around what medical personnel and resources have we got available versus the potential patients we've got. And there's a lot of media profile of countries where that threshold is on the wrong side of the fence for our liking. Mass participation clearly requires a large presence of medical resources, both personnel and equipment. Battle fatigue that I mentioned the other day is no new concept, and hospitals in their core business and governments who are running public hospitals, private hospitals for that matter, face the same issues. They require a number of personnel to operate on a day-to-day basis. And when we look at the overall situation, to draw away from the number of personnel in the world at the moment is challenging. Those hospitals are not operating in standard times and standard resourcing. They are all in the middle of a pandemic. And one of the positive news stories we're seeing around the world at the moment is stories of how medical personnel are working through and dealing with what they're dealing with on a day-to-day basis. And that often counters the doom and gloom of the news. That we see some clips and interviews with some of the doctors and nurses and many other professions that don't get the same limelight, and for the hours and the work that's going into it. Their availability when we do start to come through this curve on the other side and hope to start building and reconvening as an industry and putting on some events with spark and livelihood is going to dictate very largely what events can go ahead, potentially the size of the event. Being able to get personnel is one question. How many you can get will be another. And another challenge will be, of the medical personnel that are available, what happens for races and events that have got different teams? Because the personnel they can get a hold of are all new and don't have that same experience. They don't have the same working knowledge. You do find the draw card of events does draw in people from all walks of life, and they do come back to see that same team. And the medical personnel that put their hand up to support races and broader events around the world are no different. They very much love coming along to an event and seeing the faces that some of them haven't seen for a year. They love looking after the same particular part of that event. There's some proud people all around the world that have looked after finish lines. They've looked after particular posts along the course. And if you go anywhere near that territory, you're on their territory. So there's a balance between their availability. They've got a real willingness to be involved, as we can see at the moment in everyday life. They enjoy it as much as the runner does and turn up on event day and have those pre-event nerves. The medical personnel love being involved in races and events as well. The challenge of this battle fatigue is significant. We don't know how strong it's going to be. We don't know what the impact will be. What we do know is that it will be an issue. Not all events will be able to necessarily go ahead as they might want to at the moment. So having early planning is a really essential part of that. And I suggest that one of the solutions to that really is going to have to be working together as an industry. So where you're looking at scheduling an event at the moment, being very aware of other events that are looking into that space. So events in the second half of the year have got usual dates they're hoping to hold on to. Anything that's been pushed from the first half of the year, we'll be looking to potentially overlay in the second half of the year. And where we've got multiple events occurring at the same time or in close proximity of each other, that will again draw on whatever limited resources are available. And once we get to that point, not if we get to that point, once we do get there, battle fatigue, that term, Chris, you started with, is a significant factor. We're talking about a lot of people that are doing 12 to 15, 16-hour shifts, day in, day out, because that's what they do. That's the skill set they've got to offer. There's people that need it. And in the same spirit that they come out and support events in year out, they're in hospitals at the moment doing what they do best. So there is a real risk that as we come out the other side of this, those personnel will be fatigued. They will be tired, and some of them have a lack of availability because the government that employs so many of them in the public system has to hold them for those unfortunate but inevitable flare-ups that we will see for a long time, second waves and third waves. And the last part is, of course, we're talking about a profession that are on the front line in a high-risk environment and will have been there day in, day out for months on end. And by the time they get to that point, they probably want to put their feet up at home for a couple of days as well. So it's very hard to measure at this point what that impact will be. What we do know is that it will be a strong factor.
Thanks, Hugh. And Mike, I guess in practical terms, whilst right now, with your postponed Chicago, you'd be looking to have those conversations about, what teams and so on are available. How are you finding the ability to be able to have that? Are you being able to have, meetings with medical staff at the moment, or are they just so stretched that they're saying, look, get back to us in a couple of months' time? What's the practicalities of it in your sense?
Yeah, I mean, it's a good point, and in terms of the meetings, and we do have like a regular recurring medical committee meeting, which we've had to cancel just because of our medical professionals are, as you could imagine, preoccupied. And another part, and I know it's scalable in terms of our size versus other races, but and back to what Hugh said in terms of the medical professionals to even our volunteer corps. So we have general volunteers as well as medical volunteers, and many of those volunteers that are part of the medical team are students, right? So we have 2,000 volunteers or people that are make up our medical team for the Chicago Marathon. So that's a large number of people. And again, I know it's scalable. However, it's going to be very difficult for us to try to recruit to fill that number to have enough resources to be able to conduct an event. So you can imagine it's going to take time to do that. And right now, we can't be insensitive and start recruiting in this type of environment. So we've got to put all that outreach and all that recruiting on hold. So the longer you wait, as you can imagine, the harder it will be. The other part, which has already been communicated, a lot of the colleges and universities and medical schools aren't even going to open until January 2021. So our ability to recruit those students or at those schools, now we just lost a major resource and way to do that type of recruiting. The other things that we're facing, and Hugh, you can probably attest to this as well. Even if we could get the medical volunteers, we're just not sure yet with those different spikes that might happen again in the fall or come back, and you start kind of like some of them describe it like shark's teeth in terms of going up and down. Is like if we have a hot day in Chicago, and I know it's different in Singapore where it's consistently warm, but in Chicago, if we have a hot day, we would overwhelm the system. And we know that many of those hospitals will be prepared and still be prepared and set up with their ICUs, locked down and only for COVID type of patients. We know the ERs will be set up for them as well. So ethically, if we have our event, we're going to take away those resources or those beds to really take care of the critical patients that will need that space and those professionals to be able to treat them. So it's going to be interesting in terms of, do I feel like I can recruit them? It'll be very difficult. But again, I think we might not have the support from the hospitals in the event that something were to happen. And I think lastly, as Hugh had mentioned, the other things that we're facing, and if we could even recruit other type of volunteers, and they're the standard ones that know what their roles are, and those are the ones that you want to recruit again. So the learning curve isn't as steep, and there is a cost to that. If you had to re-educate and retrain a whole new population of staff and students that you need to replace. And again, we're running out of time. So I can't recruit. And for those new ones that I would recruit, I'm just running out of time to train. So it's getting a lot more challenging. Even this far out is getting a lot more challenging in terms of understanding where we might be. As even in June, it's really adding a lot of stress on us and pressure on us to understand what that might look like as we come out or come close to the end of that tunnel.
Thanks, Mike. And maybe a bit of a somber sense check for many of the other events that are banding around. Obviously, Chicago on one level, high profile, so you're going to get some level of attention. But as you mentioned, scale a few times, they're absolutely massive in terms of the numbers. But in terms of people that are looking at optimistic timelines of starting things in July and August, it's a consideration that makes it look harder and harder to make sense. I'd love to maybe switch over now, if we can, to the participants, and what kind of, Hugh, one of the things you spoke about in preparation was that testing is evolving all the time. It's getting faster. There's more testing kits. There's cheaper testing kits. But what are the potential requirements of participants? Is there a way? I mean, many events already require medical certificate in some countries like France. As I understand it, you have to have a medical certificate before you can even, or your doctor's certificate before you can even participate in an endurance event. You know, are these some of the things that are now going to become the new norm in many countries? And how do we then deal with that kind of testing? And as we move on to the operational stuff, we can maybe discuss the logistics of it in detail, of all checkpoints and so on. As people coming to an event, you test them at Expo or so on when they arrive. But, you know, what are some of the likelihoods from a testing perspective that are going to make it easier, and the ease of getting a medical certificate, which is valid? Because the other thing that we hear and read about often is, you know, I might have COVID-19, but the symptoms don't present for a number of days. So I get a medical certificate, I turn up at the event, then I test positive, you know, symptoms develop, and I test positive 2 days after the event, and I'm potentially impacted and infected a number of people. Just some thoughts on that, please.
Yeah, there's certainly a natural topic that's evolving in that space, I suppose, at the moment, that I suppose mass participation and social distancing just don't go together. So we have to look at the other way. How do we go down the path potentially of finding out that people aren't COVID positive? It's a very complex process to potentially go down that path, and beyond the realms of the resources of most of the industry, and particularly the time where the economy is where it is at the moment, without even being able to quantify how viable events are as they were. To now add new layers like that is clearly going to be a challenge. I suppose from the medical side of it, there is possibility of that becoming a viable option as we move further and further away from where we're at the moment. How far we need to go before that becomes a viable option is anyone's guess at the moment. Some of the models that we're working through do explore that as a possibility. We're very proactive in looking at how does testing look, and more so, if you look at it from the other angle, it's not about will this test apply to us. We've started off with a model saying, what kind of test do you need? What kind of test offers the parameters that would allow us to operate in that environment? And one of the early hopes, I suppose, is watching what testing is available. It has been a success story for a number of countries. Testing kits as we know it, and early testing has been very key to governments around the world dealing with this as a health crisis. In terms of getting back onto our feet, is testing a possibility? Absolutely it is, but there's a range of complexities that are involved in it. The testing at the moment wouldn't give us the confidence to be able to guarantee that somebody wasn't positive, but we do know that everything is progressing at the moment in terms of research, technological developments. Everything is progressing faster than we've ever seen. So the beginning of March, some of the announcements that were made around the testing that were available, some of the kits that were brought out, some of the progress that we've made down that path that seems to be getting a lot of media attention, the path towards a vaccine. The early stages of that were achieved in 2 months would often take 12 to 18 months. Vaccines can take 5 or 10 years. So while everyone's trying to extrapolate to work out how far we get to, how far we're looking at before we find a vaccine that can really clean up this whole situation, testing is very much a similar trajectory. At some point, the testing will improve and become more available. Certainly over the past 4 weeks, as we've seen more point of care testing available, some reliable, most of them not clinically graded and not so reliable, but inevitably what we will see is reliable testing well before we do see a vaccine available, if we do find that vaccine. So there's certainly no clear answers at the moment around how do we do it, or can we do it, yes or no. What I would say at the moment is I think at some point there will be an ability from a medical perspective to do it that way. But what we can't measure up at the moment is exactly what that looks like. And we also can't align when that medical aspect ticks the right boxes and then financially it's feasible at the same time.
Yeah, thanks, Hugh. Good insights there. I mean, Kelvin posted in the chat again that, Singapore, they have a kit which gives you a result within 10 minutes at the moment. Again, these are obviously evolving really fast. I've got Rodolfo Villalobos coming in from Costa Rica saying that they're looking at opening events up in September, and the idea is to have tests and doctors there testing everybody. So obviously the testing element of it is very key. But what you seem to be leading towards is more testing on site rather than people turning up with a medical certificate. And maybe Mike, to throw to you in terms of some of the thoughts that you've been exploring. In the ideal world, Chicago's got people flying in from all over the world, and obviously there's a question mark about how viable that's going to be in the time frame that you've got. But any thoughts in terms of the things you're discussing at the moment from a participant perspective?
Yeah, I mean, we're taking a look at testing, and again, everyone wants the effective vaccine, but like Hugh said, that is a long way off. But again, we'll be cautiously hopeful in that front. But you're taking a look, and we're always looking at you hear a lot about, we can do temperature readings. You hear these testing kits as well for antibodies, et cetera. So there's positives, negatives, probably more negatives with temperature readings based in a live environment, and when you do it, and that's not completely reliable as quickly as we have to scan people or test people. It's good for the office environment, where you can take more time and get people to get back into the office or work in a workspace with others. But just hearing, and I did read an interesting e-newsletter from, I think you got that as well, Hugh or Chris, from iCrowd, Intelligent Crowd Solutions by Dr. Stuart Weiss, the medical lead for New York races. And it really did shine a light in terms of the complications there are with using temperature readings for mass events, especially outdoor events. So it did shine a light on that in terms of what is feasible. And then when you do have these testing kits, that might be great, but when you do it and how you do it, as Hugh knows, is going to be important. What happens? What's your policy if you get a positive hit and someone has COVID, and where did that take place, and are there other people around them? So how do you contain them, and what is that emergency protocol, and what's your action after that? You get two people, and then how are you tracking in terms of where they came in contact? Did they get were they on a bus with other general people? Were they in line? Were at the expo? So there's a lot of issues, and testing sounds good, but there's a lot of ifs, as you can hear that, a lot of ifs that go into it in terms of where it's done and who's around them. And I know that, Hugh, the thing that people are looking for is, can you get a test, and then can you show an app, and you have that certificate, and here's my QR code, and that I have the antibodies and I'm immune to it, right? So that's where, but again, that's not gonna, I don't feel that's gonna happen within this year. That's just, it's gonna take time. Then you get technology, and those are all things that, hey, that's the silver bullet, but that silver bullet, I don't think you're going to see for several months or into the beginning of the next year. So unfortunately, it's like you want to hope for the best, but at the same time, we need to be realistic. And on that note, I just some of the things that we've looked at here and been collaborating about, and Hugh, and I know Chris, you guys have looked at this as well, is just the event risk management timetables and what that looks like. And I looked at a really interesting model the other day, and as we're thinking about how can we get these events running again and what's feasible, it was really eye-opening when you take a look at some of these existing models that are out there. And one that I saw that was made available, and again, I don't have enough information. I don't know what type of data they plugged in there, where it came from. So it would change based on the environment, based on the state or country for that matter. But it was provided by the Event Risk Management Solutions company. And it was really interesting that it showed, that the different key risk indicators that were plugged into it. It really showed the time frame and kind of the different stages, and whether it was a high, if we were at a very high risk to medium to low. And obviously the medium to low is where you want to be able to host an event. And it kind of went through these different stages for like where we are now from Q2 to, Q4, et cetera, through this rest of this year. And we're right now we're in the stage of like that stabilization and preserving. So whether it's stabilizing our company, our teams, our staff, and preserving them in terms of, from insurance, from cancellations, from staff, in terms of, in terms of their salaries, then you get into a second stage where you have to enhance those plans, make modifications to those, crowd flow and physical spacing and distancing, and whether we have to incorporate as backup virtual runs. So those are all those enhancements. Then you get into the a reset and restart of an event. Again, postponing to a different time, outright canceling, and new target dates. And then you get into a recover phase, and that's when you can really be in that medium to low area. And that's our new normal or our new abnormal. And again, that's when we have these new plans, and we're going to have to execute them based on this entire timeline. And it is stretched out. And when you look at it with these types of disruption type of tables and timelines, we're talking immediately. We're trying to get this stuff going back as quick as possible. You hate to be a downer, but when you actually can visualize this and plug in all this data, it's a long time, unfortunately. And, you want to see 2020, 2020, and when you start to look at these tables, you see 2021. And then that is, what you want to be positive, but those are things that you have to take a look at as well. And there's tools out there, and I would definitely suggest taking a look at those.
Thanks, Mike.
To add to that, Chris, for a second, I suppose a lot of what Mike and I have spoken about, and numbers of questions that people will inevitably walk away from here and keep discussing for a period of time, is that testing focus. And as Mike said, there's no silver bullet in this. What we're looking at when we are moving forward, as you started the discussion today, was around what might that footprint look like moving forward. That footprint isn't going to involve one solution. As an industry, we're not waiting for the vaccine to come through and we return to a normal footprint. We're not looking at having a new footprint that is based around point of care testing on site. We're not looking at one particular model that will create a one-dimensional layer over the top. Whatever it is, that new footprint will be multifactorial. And that is going to be very new for us because we've obviously got a number of health-related operations in place. If you look at the size of sanitation operations in Mike's race and larger events around the world, they're significant for obvious reasons. What we do know now is that no silver bullet's going to fix this problem. It will require a number of layers to be put in place, and a lot of that will be dictated based on the individual events, geography, location, geopolitical circumstances, the circumstances that our team started to look at potentially in Singapore in the back end of the year. If we look at Singapore, December as a model, one, we've got time. Two, Singapore in itself is an island nation, so its border control is a factor that a lot of cities, let alone countries around the world, don't enjoy. The Singaporean government has a very long, successful history of managing disease outbreak. So the factors that we're looking at for a race in Singapore in December are very different to the ones that we're looking at for a race, for example, in Australia or Philippines or New Zealand in February 2021. And timeline will help in one way, shape or form. But that external environment away from the race can also become part of the solution, even though at the moment it is very much part of the problems that we're facing, some of the issues that we're trying to answer.
Yeah, and it's a very valid point. It's and same with the analogy of Boston bombing. It was there was general stuff, but it had to be adapted to different situations, different environments, and so on. I just want to quickly swing back to the testing, and one of the points on the list, but given that it's come up now, was legal and liability. We've got Michael Iser on the call, who's an insurance broker for your event, Mike. It's your event? No, another event. Sorry, but Michael's point is, your liability potentially increases when you're doing testing. You're in a position there where you test someone, I'm assuming that, insurers are saying, well, your premium's going to go up because, because you're doing this screening, you might miss people. Someone else, CJ, I think, made the point about what about false positives? So you're in a situation where someone's turned up, they've done all their training, you test them, and then they discover that they were negative, and there's potentially a liability case against you because you stopped them from participating. So there's all these liability nuances and insurance nuances that go around it that would need to be explored as well. I'd love to, and as we said that you've just highlighted, it's going to be a number of different layers. There's no silver bullet. So why don't we've got about 15 minutes left. Why don't we just go into, and a lot of this is going to be quite hypothetical, but I think coming back to you, Mike, some of the operational elements of it now. We spoke the other day about things as complex of, chain of custody of food and drinks and those kind of things, waste disposal, access control, contractors. How do you ensure that your contractors are doing the right thing? All those kind of things. Maybe let's just throw back to you for a few minutes to share some of the work that you've been doing operational, and then we can swing back to Hugh to get his, medical operational elements. But from a race delivery operational things, it's so multifaceted, isn't it, Mike?
Oh, absolutely. And, those are things that we're at least trying to investigate and things that we can do. And, a lot of it's also kind of working on how do we start to reopen our office, and a lot of those practices that we would be employing and following through and practicing would obviously be carried over in terms of how we incorporate a lot of that learning and those practices into the event space. So as we talked about, I think an important one is going to be that environmental safety, what it takes from maintenance to cleanup, like you had mentioned, the cleaning and sanitization of the different areas where people are going to be gathering, whether that's going to be transportation and vehicles to an expo, what that looks like in terms of general space where people are going to be, not just participants, but also gaining the confidence of the volunteers, and how do we clean the areas where they're working? How do we create that space where they're standing and doing their work? What do we do at the check-in areas for volunteers, and ensuring that we have a standard practice and timetable and ensuring that it gets done. And those are things that we're looking at. It's like whether it's their services that will be provided by different maintenance companies, or schedules that we can at least have that different teams, area owners or volunteers would be responsible for cleaning counters, cleaning tables, wiping down doors, et cetera, to production trailers and whatnot. And then it comes down to, the other parts of like food safety, as you just alluded to. And I see Rodolfo also asked about, what happens in terms of the fluid stations. And, there's been a lot of great discussion from like Running USA, when they just yesterday, they had brought that up with Michelle Lasala from Blister and Pace Management, as well as Stacy Embertson from the LA Marathon. And they talked a little bit about that, and other people had chimed in terms of what their best practices are. So you've heard everything from people that are just distributing water bottles at each station, which doesn't do much for sustainability programs, as well as refilling stations in terms of waters, and having people and recommending people and suggesting them to bring their own devices. So there's probably ways that you can distribute water without contaminating the spigot or source. And then there's the cups, and again, different practices of how you can better handle the cups. And it's going to come down to a lot of training, additional training. So fortunately, for the past couple of years, we've been focused on food handling and safety, food defense. And again, that's been a concern from a security aspect in terms of, the chain of custody. And that's where that part came from, as we discussed that. It's like understanding where that product is and who handles it, whether it's in a warehouse, transportation, how it's distributed, if something were to happen. And that was really born more from contamination. If someone were to do something nefarious, you need to be able to understand how and where product was distributed. Fortunately, in the same type of food safety, we've been implementing, over several years now, in terms of how we distribute food, what do volunteers have, whether that's gloves. And I know that the whole issue about wearing gloves is going to be, the best protection against COVID. However, I think if we're so used to it now that a lot of people, in the frontline workers, deliveries, et cetera, do wear gloves, do wear masks. And again, I think one, it's about perception. Two, I think everyone's used to it and would refrain from having gloved hands and touching their face. I think we're getting better uh, better at that as well. The other part is Hugh can probably attest, when you do distribute water, COVID aside, and that's been a general practice, you don't want to contaminate the water with anything else and any other bacteria or whatnot. So, can we include face masks so people, aren't contaminating each other that's sick, or as well as any type of fluids that are being poured or distributed? So those are some of the logistics things that we're looking at, and the practice is about spacing, how much time it'll take to, in our case, fill water cups, the layers that we'll put covers over, how we distribute them with gloved hands, only 2 people at each table, which naturally comes out to 6 feet in between. But again, if we're talking 6 feet in between every person, it's, again, those are things you have to think about. It's like Hugh said from the very beginning, it's going to be very difficult to have mass gatherings, and you always have to guarantee 6 feet, whether it's the volunteers, operationally, staging, especially at the start line, to what happens on the course, which is a little bit easier because people, over time from 2 hours to 6.5, 7 hours, it will spread out. But the toughest part, and we're trying to model this, is really what happens at the start line. How do we get as many people that we need staged and spread them out over time? So as we know, and we're taking a look at different models, I think time, and the more time you have, the more opportunity you can create space. For example, at the expo, will there be expos? But if you can do multiple days, and you elongate that over time, you can create space. And if we're taking the same type of approach and thought about the start line, if you can extend how long a start goes, you can have people come in at different times or graduated pace to get to the start, so you don't have to just wait and congregate. So those are definitely a lot of things that we've been thinking about for now, and something that you're going to see, I think, that's going to be carried over, from now in the future. These types of practices, especially the food defense, and even after the end of the COVID situation, that's a good practice to have, period, in terms of how people handle food products and water in general. So it's a good practice that people should employ, and industry should employ going forward, regardless of a solution to the COVID crisis.
Thanks, Mike. Some really great insights there. And obviously those, longer start lines, longer expos, we're going to touch a little bit. And I think no one's got any real idea of cost and budget implications at these stage, but it's also going to, that collaboration is going to be so important, because you're going to be going to government agencies saying, I need an extra 2 hours for my race, I need road closures for longer, or you end up with smaller fields, which again comes and impacts the commercial viability. So this whole, for me, and you're aware, and many on the call, my passionate discussions about, I think we've had our narrative wrong for so long, in terms of, we've missed the opportunity from the narrative to highlight to governments the health and well-being impact of what our industry creates. And, that's maybe going to have to be, further up the table in terms of, we've got to do this in collaboration with cities, because the impact that we have on the health and well-being of participants means that maybe we can justify longer road closures. It's going to be a long conversation, and it's not going to be an easy one. But these are some of the discussions that we have to start now. Yeah. Then we've got things like baggage check and all those kind of things that come into it operationally there as well. Hugh, why don't we swing over to you to just talk about some operational things as well. Thanks there, Mike, and then we'll come down to staffing and try and touch on cost and budget implications before we wrap up.
Mike's just alluded to so many handfuls of relevant points across an event and its operations. It's obviously testament to the experience he and the team have. You could follow on each of those points another 10, 20, 30 steps, and that's the kind of detailed planning that I suppose so many people are potentially looking at. Mike and his team are obviously in the forefront of that, and for so many others who haven't got the same size teams or resources available or scale of operations, that can be quite a daunting forecast. You can be looking down the barrel of something that is so big and so daunting, and don't have a starting point, that it can all become overwhelming very quickly. I suppose when we talk about chain of custody as an example of food and water, nutrition and hydration are very essential parts of mass participation, endurance racing. Personal hygiene, as Mike alluded to, is actually one of the big reasons that the world's got this health crisis. We so often go to touch our faces, and changing our personal hygiene habits at the moment goes a long way towards minimizing transmission and disease risk. These days, while we're all starting to feel the changes of it, it's still Zoom. I get a scratch on my face and get itchy, and I want to touch my face. It tends not to be the rest of the time where I become more aware of it. But we can't just change personal hygiene habits, and we can't just change that chain of custody. There are going to be existing measures that have to be extended. We're going to have to retrain people. I think we'll also see a combination of new factors put in as well. I'd be very surprised if we don't find the concept of quarantine finding its way into logistics and race operations at all sorts of levels. Cleaning and sanitizing surfaces is obviously difficult, and how do we do it, and the cost of the chemicals and the environmental factors. Time can also create sanitary surfaces for us. We do know that every virus eventually dies on a surface. So when we look at quarantine periods, for example, if we go down a path of cups to host water instead of handing out water bottles, because environmentally it works for us, it's a better solution in a number of aspects. Those cups, for example, can be contaminated before they are handed out on race day. So we can go to the efforts of training volunteers at aid stations up to hand out cups of water and glove them and cover them. And we could have hurt ourselves at the start of that chain of custody. So the kind of thing I think we probably will see an introduction of is the concept of quarantine. Those cups can be put in store, whether away from contact and clean surfaces initially for a period of time, because after a certain period of time, then we know that it will be virus free. The first question that probably raises amongst so many is, well, how long do I need to put things in quarantine for? Again, a question that we'll need a bit more time on. It's pretty evident at the moment that different surfaces support or don't support the life of this particular virus, but that's no different to any other disease, virus, bacteria that we've got to deal with on a day-to-day basis either. So what we will probably see as we get again closer to the back of the year is greater information around how long it lives on a surface. At the moment, evidence suggests that it lives on plastics for a period of somewhere between 3, 4, 5, 6 days. That's what all the evidence indicates at the moment. Whereas some surfaces like cardboard, it seems to be around for less periods of time. There's some fantastic evidence, some studies out of the US and the UK at the moment that have looked at that. So the types of surfaces that we're using in permanent and temporary infrastructure will play a part in what we can do. So it's just a new layer of looking at what's feasible, what we do now can't go and trash the environment when we're making steps towards that. 6, 12 months ago, there was so much focus on some of the great direction we're taking with environmental management and the impact that events have on it. And a lot of practices when, on a day-to-day basis, if you were a restaurant that served single-use plastics, sitting on a lot of airlines moved away from little single-use plastics for butter and condiments and moved away because of the environmental impact. And here we are less than 12 months later from something that gathered a lot of momentum, saying plastic is potentially one of those things that can be used to keep hygiene in particular product. So there's a lot of rethinking to go back through and do, which is where I think we might find new practices like quarantine come in, where equipment, resources and suppliers potentially are put into a space over a period of time, and that keeps them in a sanitary environment.
Thanks, Hugh. Some great insights there again. Thank you so much. We've got on the list staffing. I think we've touched on staffing quite a lot already. The challenge of getting volunteers, the fact that many core teams are going to have been reduced through furloughing and so on, the timeline that's going to be needed for planning, and then obviously the all important training, which could take up a lot of time and money resources. So I think we've touched those in the various areas. So let's move on to costs and budget implications. We're running a little bit over, but with the permission of everyone, and I noticed only a couple of people have had to drop off. So let's just keep going for a little while longer and just touch on, I think it's a little bit how long is a piece of string, but Mike, you've been doing a lot of work so far, and not expecting you to disclose numbers, but do you have any sense yet from a percentage perspective of what the likely implication might be on your budget that you're going to need to allocate as a contingency to deal with these kind of things?
Yeah, again, I think, all of us love to be able to do enhancements with new initiatives each year. So a lot of those that we would have liked to do, the nice to haves are going to be, cut back so we can make space for the need to haves, and just everything that we've been talking about, new equipment, different supplies, additional hand washing stations everywhere, sanitization, face masks, if that's the direction we want to go in. So we're able to make some adjustments because we had budgeted, on an ideal year, a regular year, we would have continued to make these enhancements. So we'll pivot a little bit and readjust our budget. So there's really not an additional loss for us, since we could just take our enhancement development type of budgets and reallocate those. The ones that we will be impacted by is, again, you just don't know who's going to show up or not. If everything continues to move forward as planned, with a lot of the fall races or spring races moving to the fall, that will cut into in terms of how many, the participants that would have run a spring race as well as a fall race. And if they elect to go do the postponed and rescheduled spring race, obviously that will impact us in terms of where they decide to run. And obviously when you don't have people that are showing up, there's always that residual impact, especially depending on your financial models, in terms of, do you have commissions on hotel rooms, obviously additional heads and beds, there's models that you make money that way, as well as, people that are here. So yeah, do we have a full field? That's all fine and good, but if they don't show up, they're not buying merchandise, and your impact to the local economy will go down because they're not here, going to hospitality, staying in hotel rooms, transportation, etc. So that's all things that we're looking at, and you just don't know in terms of what those concerns are, and are they going to show up or not. But there's opportunities or ways that you can see or ask those questions to see who's actually going to come to the event. So we're exploring maybe those types of surveys and questions as well, that I think other races would benefit from, to really get a sense, like you said, Chris. It might be a way to create distances. You don't have as many people, so that could play into it. It might have an impact to the bottom line, but it's also helping in terms of the less runners you have, the less space you need, in terms of additional space. The other thing that could benefit is if you're in time and haven't made those plans or orders based on medals or shirts or other goods, you can reduce a lot of those expenses. So that can also help you, kind of offset that loss of revenue that might be built in for every person that you want here at your race in your city. So again, those are things that we need to kind of recalculate, look at, and understand what some of the additional costs are, what can we reallocate, and what are some of the loss of revenue. But also, would it be our plan to look at things that we can slow down, adjust our orders so we can offset some of those expenses, and just be creative with the information or ways to get the information in our hands.
Thanks, Mike. Yeah, obviously, both parts of the budget, the revenue is going to be significantly impacted in some areas as well. Hugh, we've spoken about testing, we've spoken about all the extra equipment that's needed. Is there any sense yet? Is it a percentage of a budget for the extra testing costs? Is it a per runner cost? Is in any of the modeling that you've been doing? I think there's probably many people on this call that are kind of scratching for answers at the moment. And as you said early on, there's many more questions than there are answers, but people that are trying to put contingency plans in place and say, well, how do I even begin to budget with you? Firstly, we don't even know what the regulations might end up being, but any rough sensing, if you were an event director at the moment and you were having to reforecast, what would you be doing to your medical budget? Would you be increasing it by 25%, 30%, 50%?
Oh, look, the starting point, I'd be saying I've got to increase it. Beyond that, I'd be talking to my key people, talking to medical team, or reaching out beyond that medical team, and that's something that as we go down the path, if people want to have a discussion about it, I'm more than happy to offer advice. At this point in time, I couldn't offer a percentage. I couldn't offer a model in which to do it financially. I think that's probably dangerous for me to go down the path of. What I would probably say, though, is that in 2013, Boston went through a horrible day that the whole world looked at in shock. And the fallout from that was an increased security footprint. We've looked in more recent years away from mass participation in the broader event industry at things that occurred in the UK. The Ariana Grande concert in Manchester had an impact on the broader event world. We've seen a number of incidents. Stade de France had a high-profile security incident during an international football match. There's been a range of things that involve events of all different nature. And each time that occurs, we all grimace because we feel there's a hit on a bottom line that says, I now need to add more layers. So the reassuring aspect at this point is that it's not something that the industry has ever faced before and not overcome. We're still here. The entire industry is here. We've evolved. We've found new ways of doing things. We've found effective ways of doing things. We become efficient. During times like this, times of depression, difficult periods of time, we often find the greatest innovation across all areas. Technology is a great example of that. So I think maybe what we'll probably find is not so much over a period of time that we will have to increase an overall operating budget by a certain percent. There will be an increase to medical, and it will probably come in a natural combination of an increase in those health and medical costs initially, over a period of time discovering how those costs can be integrated into other aspects of broader operations. And I think that's probably a really big key to making this a feasible direction that we move forward in, because so much around health and medical as it stands is viewed in an isolated manner. There's an element of everyday health and hygiene practices, but if we're looking at having to deal with new layers because of an acute health threat, the most cost-effective way of bringing that into the race is how do we implement that across everything that we're currently doing? How do you change what we're doing? How do you do it differently? How do you integrate these new concepts into what you're already doing? And that'll minimize the cost increases. So I think that's probably the best approach moving forward, because the only alternative, if we're not looking at those two options, clearly is to have to increase revenue. And it's not a time that we're going to see large increases in corporate or commercial support in the short term. The financial outlook for a lot of corporates is obviously not exciting. And likewise for participants. The last thing any race organizer wants to do is increase the fees for any event. So I think the first options are probably the best way to go about it. Once we start to get a feel of what those measures look like, work out how to integrate those across other aspects of the event, and the cost itself won't be this isolated balloon.
Thanks, Hugh. That makes great sense. Wonderful, thank you. Just want to pick up on the technology one, and probably the one last question we'll take from Dennis Cranston. He said, what new technology applications do you see as mission critical in the new normal, both physical and digital? Any thoughts from either of you on those?
Mike might have something.
Yeah, I think just to Hugh's point. I think it's a little early to tell in terms of what that is. I don't know where to apply that type of funding or spend on that technology. Again, where you would think you would put technology could be the scanning and temperature checks and everything like that, but we don't know if that's the solution. Is it going to be in terms of the testing kits and everything? But again, I think the last part on here in terms of the legal liability and what you heard from Mike Geiser, the insurance broker, it's like, that there are some things it sounds like it could be a fix, but by doing that, you're opening yourself up to additional, liability as well. So right now, I other than just procuring and looking at different costs and equipment that we'll need and face masks and those things that are more physical and tangible, and we know that those things will still stay, that'll still be good. You can store them and you can use them, throughout, for a long time, for a period of time. I think those are the things that at least we know that we can do. Might not be the exact answer, but at least we know that we could use them, repurpose them for future uses, and it wouldn't go to waste and be a bad spend. But technology-wise, at this very moment, I can't really tell you what would spend that money on and what we develop.
Yeah, it's a great point. Thanks,
An
Mike.
early line of thinking, I suppose, to maybe provide some light on that one, Chris, is technology will become a solution to a number of the headaches that we've got, even if we don't know what they are at the moment. I suppose as a natural touch point on testing, which is one that no matter how much we talk about, it will continue to stay in the discussion for a period of time without ever becoming the silver bullet that we probably hope it will, or would like to think something would become. Testing in itself will evolve very quickly. I think earlier I was trying to allude to the fact that testing will develop faster than vaccines or a potential vaccine might come to fruition. A lot of focus on testing at the moment, and a lot of technology is focused around research-based testing, not diagnosis. We're still in the infancy of this as a medical issue. The virus first appeared on international radar only in the very start of the year in January. In the first week of January, did most of the world pick up on there's a new virus floating around. What does novel coronavirus mean? They were the discussions we were having really only 3 months ago. And whilst the backdated timeline in that shifts back a couple of months into what appears to be November at the moment, when we look at the time frame of what we have available, the medical world and the research world is still looking at this to understand, for example, what long-term effects are. There are no patients that have had COVID-19 for more than 6 months. So we don't know, there's only first indication of what some long-term illnesses might look like. So at this stage, it's probably worth pointing out that the investment in technology around managing COVID in different situations has all been focused upon dealing with what we're faced at the moment. And the start of that is research. So a lot of testing that's been put in place in various industries so far. I know my hometown in Perth has a number of testing establishments that have been set up, and a lot of that's been focused around research. How do we track people and their response to exposure to virus and antibodies and a lot of other words that are finding their way into the discussion at this point in time? What we're not seeing at the moment is a large investment in diagnostic testing. So while testing is in a number of ways, shapes and forms evolving at a very rapid rate, we're not seeing a primary focus on point of care diagnostic testing, which is the kind of thing that I think a lot of people are probably asking about in this space. When do we get to that time? I don't know. But as we start to get a better feel as a species of what this disease is doing, and we've got a better understanding of how it's being dealt with, and hospitals and health systems are dealing with things better in terms of the way they want to, what we will find is technology's played a natural part in some of the topics that have come up today. And that does look around point of care testing and testing kits available and the parameters of testing that they are able to offer us.
Yeah, that's great insight. Thank you. Thank you, both of you.
And I think just real quick to add on, and I think some additional resources that we'll look at, and it kind of goes back to, finding additional time and resources to do more risk assessment and mitigation. And that's something that we can do, and any event should be doing regardless. but especially in the case of the COVID, as we talked about, there's different companies that do that, consultants, different tools that are available to plug in different metrics and data. But again, I think we're going to be doing and looking into that a lot more to be able to paint a better picture for us so we can make some better informed decisions. And we need to do more of that, ourselves. And it's just been really interesting to see all this out there now and a lot of that being available.
Thank you, Mike. Thanks. Thanks, everyone. We've run a little bit over, but hopefully it's been useful. Just maybe a quick summary points of some of the key things that have come up. I think, we all agree that there's probably many more questions than answers at the moment. The point that Hugh made a number of times, there is no silver bullet. We're going to be sitting around and, how long might it be until there's an antidote for it? A long time to come. The reality is that it's not going to be a one-size-fits-all. There's going to be some guidelines, but there's going to need to be multi-level solutions to each specific event. Collaboration is going to be key, and now is the time for collaboration. Are there opportunities in your particular country, your city, to pull together a group of industry leaders to go and sit with governments and have a seat at the table with an approach that we're looking for a solution to benefit everybody, the impact that our events have on health and well-being of cities, the opportunity to find solutions that are going to benefit everyone. Volunteers and staff training is obviously going to be key once we decide where we need to go. The point that Hugh has made many times, testing is going to be crucial, but it's going to evolve quickly, and we may find some better solutions sooner rather than later. The real key one that I still feel that quite a lot of people in the industry are overlooking is just the pure availability of medical staff once we come out of this. It's going to be extremely difficult. Mike even gave his example of even getting volunteers, along 2,000 volunteers with colleges closed and so on. I'm sure that's being replicated all over the world. The concept of quarantining supplies was a great one, which I picked up on, potentially getting your supplies delivered, put in a secure warehouse and quarantined. It's going to take a lot of detailed planning. The budget things might sound scary, but the point that both Mike and Hugh seem to make is that it's an adjustment of budget maybe rather than an additional budget. There will be probably need for additional, but there might be some nice to haves that need to be left behind for the real to haves. Technology is going to evolve probably in time, but it's not going to be something that's going to be instant overnight probably. And this great opportunity that we have to research and be more informed before we get involved in the more detailed planning. And then just from a liability perspective, being conscious that a fix over here might create a liability problem for you over there. So just being conscious of all of the ramifications for that. So I'm going to hand back quickly, Mike, if anything, a closing comment that you'd like to make.
Yeah, well, just really appreciate the time that you've given us, Hugh and I, and also connecting. And we've had some great discussions, and even just going through this and hearing the conversation and kind of the answers to these questions from Hugh, and some of the comments and questions made here has been really helpful. And we'll continue to learn through this. And again, it's about that collaboration that's going to go a long way and really be beneficial to all of us. There's not that one silver bullet, but all these little nuggets will definitely help us, whether it's going to be an overall solution for COVID, but definitely will help. But there's going to be a lot of other developments and things and enhancements coming out of this, and that we could use and apply to our events down the road as well. So appreciate the time, and thank you. Thanks for everyone for tuning in.
Thank you, Mike.
Yeah, I'd like to reiterate thanks as well, Chris. Obviously to you for piecing this together and scheduling it, and clearly a topic that's resonated with a number of people, and some brilliant questions that have come through. So a big thank you to everyone that sent through questions through you that Mike and I have been able to maybe address some of it or provide some ideas moving forward, and look forward to seeing where we get to on some of those topics.
Fantastic. Thank you. Thanks, everyone. So just a reminder that we are repeating this afternoon or this evening, 7 p.m. Singapore time. So if you've got any colleagues, friends who you think might benefit, please direct them to it. We'd be delighted to have. We've already got over 100 people registered for that one. Next Friday, we'll be running one, and details will be put out on Monday. So as part of this regular series, we're going to be talking about, there's a lot of chat about virtual racing, but virtual racing more from an ongoing engagement. My sense is that there's quite a lot of events that are replacing themselves with virtual races as kind of one-offs and missing the opportunity to use virtual racing as an ongoing engagement tool. So that will be the real focus around that one. And then obviously remembering strength in numbers, every Monday. It is at 8:30 a.m. and 4:30 p.m. Singapore time to try and cater for as much of the globe as possible. You need to just register once, and then you can drop in any time. We've got a growing list of people that are registered for that and attending it. If there's anything I can help with, my email directly, chris@chrisrobb.asia. Please don't hesitate to drop me a note if you've got any questions, if you've got any thoughts for topics for future webinars. As I say, I will be running these on a weekly basis on a Friday. So, obviously the idea is to solve problems that people have got. It's not about me picking an idea out of my head. It's really trying to understand what people's problems are to try and solve them. I think this is an ongoing dialogue, and I would see it highly possible that in 3 or 4 weeks' time, we might invite Hugh and Mike back again if they're available to have a next step of this. I'd really encourage you. Collaboration is going to see us through this. Work with your local communities, with your government agencies, and so on. And thank you so much again, Mike, Nishi, Hugh Singh. I'll see you again in a few hours. Thank you to everyone who tuned in. Apologies if we inconvenienced you by going over, but just thought it would be useful to continue the dialogue. Thank you so much. Have a great night, day, wherever you might be. Sleep well, Mike. I'll see you in a while. Bye-bye.